Complete menstrual cycle for women. The menstrual cycle is a series of natural changes in hormone production and the structures of the uterus and ovaries of the female reproductive system that make pregnancy possible. The menstrual cycle is a series of natural changes in hormone production and the structures of the uterus and ovaries of the female reproductive system that make pregnancy possible. The ovarian cycle controls the production and release of eggs and the cyclic release of estrogen and progesterone. The uterine cycle governs the preparation and maintenance of the lining of the uterus, womb, to receive a fertilized egg. Naturally occurring hormones drive the cycles. The cyclical rise and fall of the follicle-stimulating hormone prompts the production and growth of oocytes, immature egg cells. The hormone estrogen stimulates the uterus lining to thicken to accommodate an embryo should fertilization occur. Triggered by falling progesterone levels, menstruation, a period, in common parlance, is the cyclical shedding of the lining, and is a sign that pregnancy has not occurred. Each cycle occurs in phases based on events in the ovary, ovarian cycle, or the uterus, uterine cycle. The ovarian cycle consists of the follicular phase, ovulation, and the luteal phase. The uterine cycle consists of the menstrual, proliferative and secretory phases. The ovarian cycle describes changes that occur in the follicles of the ovary, 1, whereas the uterine cycle describes changes in the endometrial lining of the uterus. The hypothalamus releases gonadotropin-releasing hormone, GnRH, which causes the nearby anterior pituitary gland to release follicle-stimulating hormone, FSH, and luteinizing hormone, LH. The thickness of the endometrium continues to increase in response to mounting levels of estrogen, which is released by the antral follicle, a mature ovarian follicle, into the blood circulation. Peak levels of estrogen are reached at around day 13 of the cycle and coincide with ovulation. If implantation does not occur within about 2 weeks, the corpus luteum degenerates into the corpus albicans, which does not produce hormones, causing a sharp drop in levels of both progesterone and estrogen. Through the influence of a rise in follicle-stimulating hormone, FSH, during the first days of the cycle, a few ovarian follicles are stimulated. At the same time, the granulosa cells surrounding the maturing follicle develop receptors that bind FSH, and in response start secreting androstenedione, which is converted to estrogen by the enzyme aromatase. The dominant follicle continues to secrete estrogen, and the rising estrogen levels make the pituitary more responsive to GnRH from the hypothalamus. The developing embryo takes about 3 days to reach the uterus, and another 3 days to implant into the endometrium. During the first few months of pregnancy, the corpus luteum continues to secrete progesterone and estrogens at slightly higher levels than those at ovulation. Lasting about 14 days, 4, the luteal phase is the final phase of the ovarian cycle and it corresponds to the secretory phase of the uterine cycle. From the time of ovulation until progesterone withdrawal has caused menstruation to begin, the process typically takes about 2 weeks. Menstruation, also called menstrual bleeding, menses or a period, is the first and most evident phase of the uterine cycle and first occurs at puberty. Menstruation is initiated each month by falling levels of estrogen and progesterone and the release of prostaglandins, 20, which constrict the spiral arteries. The secretory phase is the final phase of the uterine cycle and it corresponds to the luteal phase of the ovarian cycle. There are common culturally communicated misbeliefs that the menstrual cycle affects women's moods, causes depression or irritability, or that menstruation is a painful, shameful or unclean experience. Around 40% of women with epilepsy